Hi, I'm Dr. Tracy Paschke with Heart Health Prevention and Wellness. I'm a board certified cardiologist with over 25 years of experience taking care of people with heart attacks and heart failure. And now I focus solely on prevention, so helping people prevent strokes and heart attacks and heart failure in the first place. So today I wanted to talk about what is a heart attack, understanding what causes a heart attack, and how we can prevent them. So heart attacks, the other medical term is myocardial infarction. So that's a severe medical emergency that occurs when blood supply to the heart is blocked. Usually it's caused from plaque rupture and developing a blood clot, and it results in sudden occlusion of blood flow to the heart muscle, and the heart muscle can become damaged. So a little bit more about this mechanism. The process that leads up to a heart attack typically begins with what's called a fatty streak. So we can see these fatty streaks even in children. So that's the very first sign of atherosclerosis, these fatty deposits. And then people can develop plaques, cholesterol plaques along the walls of their arteries, not only in the heart, but also in the neck arteries and the leg arteries. And these plaques are composed mainly of cholesterol. There are two kinds of plaques. There are hard plaques that become calcified and what we call a stable plaque. And then there are plaques that we call soft plaque or juvenile plaque, and this is the unstable kind of plaque. So most heart attacks occur in people that have just mild cholesterol blockage, mild plaque, but what happens is that mild plaque becomes inflamed and unstable, and that leads to plaque rupture and formation of a blood clot. So if this blood clot's big enough, it completely occludes blood flow in the tiny artery, and sudden disruption of blood flow, and if it's in the heart, it's to the heart muscle, and that can cause the heart muscle to become damaged or die, and that's what is a heart attack. So what are the symptoms of a heart attack? We should all be aware of these symptoms, and if you have any of these symptoms, you should call 911. So the classic symptom is pressure on the chest, so an elephant sitting on the chest. So it's pressure, tightness in the center of the chest. It can be fullness or described as squeezing, may last a few minutes, may go away and come back. So any unusual pressure in your chest, it's often not described as pain, so not really like a sharp pain, but again, more of this pressure or tightness. Sometimes it can radiate, the discomfort can radiate up into the jaw or into the left arm. You might have shortness of breath with it, meaning you just can't breathe normally. Other symptoms include breaking out in a cold sweat, nausea or vomiting. Some of those GI type symptoms occur more often in women, so something to be aware of. Lightheadedness, extreme fatigue, so all of these can be symptoms of a heart attack. So we have some great treatments for heart attacks, angioplasty and stenting, where they go in and open up the arteries and restore blood flow. But we want to prevent heart attacks from occurring in the first place, right? So how do we do that? Prevention is crucial. So some key strategies. First of all, follow a mostly whole food plant-based diet. So less meat, especially red meat and processed meats, less fats, especially saturated fats. We want a diet rich in fruits, vegetables, whole grains, lean proteins, and this diet's good for our arterial health, and it helps lower our blood pressure and our cholesterol levels, which again help reduce the risk of plaque formation in the first place. We want to get regular exercise. Regular exercise helps improve heart health by maintaining healthy weight, lowers our blood pressure and our cholesterol, and it's good for our mental health as well. If you smoke, you need to stop smoking. Smoking is a major risk factor for cardiovascular disease, including heart attacks, and quitting smoking can significantly reduce your risk of having a heart attack, and it's never too late to quit. And then we want to control our blood pressure and our cholesterol. And you need to know your numbers for you need to check your blood pressure regularly and know what your normal blood pressure is. Blood pressure should be 120/80 or less. And we want everyone to know their cholesterol numbers. So what's your cholesterol? The total cholesterol. You want to know your HDL, which is the good cholesterol, the LDL, which is the bad cholesterol that makes the plaque, and triglycerides, those are the fats in your blood. And also consider getting an advanced lipid panel. So we know that there are other cholesterol particles that aren't checked on the standard lipid panel, things like ApoB and Lp(a) that increase cardiovascular risk. And then other things you can do: limit your alcohol intake. Excessive alcohol consumption can lead to elevated blood pressure, abnormal heart rhythms, and can actually weaken the heart muscle. So consider cutting out alcohol altogether. And then, of course, stress management is important. Chronic stress can contribute to heart disease risk. Chronic stress can elevate blood pressure. It can increase the stress hormones in the body, which can lead to inflammation, which is thought to be one of the things that makes those soft plaques rupture. So again, this is all tied together, and stress management techniques such as mindfulness practices, meditation, yoga, journaling, all those things can be beneficial. Heart disease is a leading cause of death for men and women globally. Awareness of the risks, symptoms, and how we can prevent heart disease and heart attacks is essential to reduce this burden. Adopting a healthy lifestyle contributes to preventing heart attacks and also enhances your overall health and well-being. So join me next time as we discuss more about how to keep your heart healthy.